Good evening, Saja. Okay, and Salar, Nadim, Amna, okay. So good evening, everyone. Let's wait the other participant to be joined, and we will start our second lecture on monitoring, evaluation, accountability, and learning. We will do a small recap, and we'll start about our second lecture. Okay. I think we have remaining Omar and some others. It's okay. Okay, guys, we will start by our recap about the monitoring and evaluation training. We will start by from here, which is we said monitoring is a routine process, and evaluation it's something you not use it always. It is the use of social research method to systematically investigate achievement of program result, but on other hand, the monitoring is toward objectives in the programs, and it is routine, which is happen usually. And after that, we said what is the purpose of carrying out the monitoring and evaluation, who need use the M&E information, who is carried out the M&E, and how it is carried out, and when it should be carried out. And what we talk about that, what is the purpose of carrying out the information from the monitoring and evaluation is to gather the data and analyze it toward the objectives of your, let's say, of your output to reach to your goals, which is sometimes called the outcomes. And the purpose is improve program implementation, inform future programming, inform stakeholders. So what is stakeholders? Stakeholders, the people or the entities that sharing with you the stake, okay? So the donors, beneficiaries, and etc. Those people who are dealing with you, they call them the stakeholders. Who need use of M&E information? As we said, depend on your position. Maybe your assistant, so your manager or your officer will need it. If you are manager, a monitoring and evaluation manager or program manager or program officer or program assistant will need it, and something like that. And if you are representing organization, the donor will need it to inform you. Who conduct the M&E? Program implementer, which is the M&E staff. How to carry out M&E? We said there is a framework and there is a different type of frameworks. We will talk about it. We will see what is the common inside it and how you can develop your own framework. And sometimes they call it M&E kit, monitoring and evaluation kit. You can use it. Sometimes they ask us as a consultant to do it with the contract. So it is, if you don't know how to do it, we will teach you how to do it in these two lectures. Okay. So program framework. Framework is, as we said, the frame of the work. So when you put the picture inside the frame, this is all the things that inside the frame is a picture. So when you put the program inside the frame, you should follow a steps, which is a systematic steps. If you can see it here, systematic layout of the program element and by showing what the program plan to do and to achieve. Yeah, sorry. Systematic layout of the program element and path showing what's the program plan to do and to achieve. Okay, to do, what that means, the activity that you will do, and the output of it will be the achievement. The goal you will reach, it will be the achievement of the program. The do is the activity and the thing that you will do inside the program or the project. This is a sample of a framework, but we jump it to this one, which is the result framework. And we said there's a different type of framework. So this is one, it's called the result framework, which is starting by strategies. Or maybe you will start it by, okay, my main idea to improve the health status of Iraq, for example. But if I want to reach this goal, I should improve all the facility in Iraq. If I want to improve all the facility in Iraq, I should go and import a new equipment with the new engineers, and these engineers will operate this equipment to, let's say, start the full program to operate in full Iraq and to improve the health status of Iraq, as an example. So we said the strategies is the movement you will do, let's say, for the future. Any strategy is talking about the future, which is we learn from the past. Okay, we study the present and the past also, and we plan for tomorrow. So strategies is also what we said is the movement that you are doing, the activity you are doing. Let's say the training, for example, there's strategies, small strategies to achieve it. Using, let's say, the Zoom, gathering the attendance, all these things together, we can call the strategies. Number of strategies will make a result. There is intermediate result, there is immediate result. So what happened, there's idea will come to you, and there's a skill will be developed, and there is maybe the quality in the program will be developed. And after that, the SO, which is a strategic objective, the overall improvement on the project. So we said this as an example. Community mobilization include main, implement mass media. So each one of these things is a strategy you are doing to reach to these goals or objectives. We cannot call them a goal because the goal is something bigger. Okay, and here what is the result? Increase of the knowledge, improve attitude toward and acceptance of key services and behavior, increase the quality of FB consulting for services, and increase availability access to FA, for example. This is all example of result framework. As we said, there's a different type of framework. We will talk about each one. So your homework was that. I think Salar, Saja, and not all of you send homework. So we will wait it from you today to send it. So we said there is an RBM protocol or RBM idea. The RBM, you can also implement it here by using the same things like the input, implementation, sorry, the output and the activity and the outcome, which is something like that, I think. Yeah, okay. RBM mean result-based management. Just as a framework, it is starting by, what it will be starting by? What do you think, guys? And well done, you remember it. Okay. This one we can say it is the most general one, or which is it is based on result. But if we talk here, input is yeah, input is your so what we mean by resources. Resources is your money, your people, your staff, for example, and your equipment, and all of these things that we call them the input. The activity, as we said, and here is, if you can, we can back to the presentation. Okay, so this is the resources, and the activity is the service that intervene provide to accomplish its objective: outreach material, distribution, counseling, sessions, workshop, trainings, and these type of things. Any movement you do, any action inside the project is called activity. This activity will lead you to a small result output, which is a direct product or deliverable of the intervention, such as intervention session completed, people reached. So this is also will be counted by numbers. Giving trainings for 10 people, 8 people from 10 people, which is our target. And after that, the outcome, which is will give you a result in immediate, intermediate, and long term. And sometimes long term, they call it an impact. Immediate result of the intervention, such as change in the knowledge, attitude, and the skills. Okay, so the skills, you will not gain it that right away, but you will gain it after using the knowledge that you get from the output that you get from this activity. And the intermediate intervention result that occurs sometime after the intervention is common, such as change in behavior, skills, access to policies, and environmental conditions. Okay, so this is will be, we are talking about any change that will be changed to the character or the attitude or these type of changes. You can call it an intermediate. And after that, the long term, which is the impact or the effect on you. And if it is impact, this will be effect on much bigger, let's say, society, our community, our country, our region level. Okay. So if you can look at this example from CDC, input, activity, output, immediate outcome, immediate, and impact. Okay, so starting, the input we said is your equipment, your people, anything you will use to complete your project. The laptop you have, the phone you have, anything that toward the goal or the objective of the program, we called it input. Okay, so let's say here there is a teacher, and here is train the nurses. The teacher trained the nurses in VCT, for example. The output, nurses and lab techs trained. So here is the training, and here is the trained. Okay, this is the output. But as I am saying always, output, you can measure it by numbers. 99% it is the numbers. Okay. So how many nurses got trained? For example, 10, 20, 30, 40. After that, the immediate outcome, it is the quality of VCT increased. So after the training, there is a quality increase. There is improvement in the quality. Okay. And after the intermediate result, which is risk behavior decreased and impact. So if we talk about coronavirus, for example, let's say we have a society and we come and we have a program on coronavirus. So our input is our test kit, our PPE, which is personal protection equipment, our laptops, our phones, our vehicles, our salaries, our staff. This is all input. So our staff will come and gather the people to teach them how to avoid coronavirus infection. The teaching method is your activity. How they teach them. What is you done to them? What you give them? Give them the goodies, give them the training, and these type of things. So this is, you can call it an activity. After we give them the personal protection equipment, for example, how many people received your personal equipment? As 100 people. So this is your output. Your outcome, maybe you will say, increase the quality of dealing or the behavior of dealing with the coronavirus infection. The impact is less transmission of COVID-19. So this is the idea here. If you have a question, ask me, because I don't want you to be confused. You should make a difference between, some people, they are, sometimes they not make a difference between the output and the outcome, because if you think about it, this is the number or the result, the direct result from your activity. And this is the after result. What is improved? What is the thing that get changed in your life? So this is, you can call it an outcome. So, okay, I'm distributing 1,000 food parcels. 1,000 families get the aid from me, which is, this is the output. But what the result after they eat this food? Okay, they stop starving. What happened to them? This is the outcome. And if you think more, what happened after that? So they can stay and they can take care of their families. So their behaviors change, for example. And after that, less violence happened after we give them shelters and, for example, a food. So this is the idea here. The number of the people who received is the output. Remember that. Okay. So here is a comparison between a USAID and others and the project design level. So what we said, improve in health, which is sometimes always the USAID called impact. Others maybe say it impact or goal. Use of the services, SO, strategic objective or purpose, or some other, what they call it, it will be the same outcomes. Demand for the services, which is the requirement for the services, which are intermediate result, IR, or specific objective. And here the intervention, which is what you will do inside the field, which is that we call the strategy, activities, and output, input, activities, and activities clusters. Keep that in your mind. And also we said there's some different organizations that are applying other things, but we are talking about generally what is they are, let's say, applying. This is casework. We will use it on the end of the training. Okay. So your monitoring question, if you are doing the monitoring, your first question is, what is being done? So what is being done? What does mean? The activity. By whom? For example, field staff. Target population. We will talk about that separately. When, which is the period of the project and the detail. How much, which is the number of the inputs. How often, which is also sometimes the period, and these type of things depend on the template. The output and resources used, staff, fund, materials, and etc. This is the general questions for the M&E, which is also, they have a big sheet and sometimes they use their questions. And maybe I can share with you one of these sheet. Maybe it will be helpful. Evaluation questions. Guys, if anything you don't understand it, just tell me and I'll explain it more, please. Okay? So evaluation questions. Is the content of the intervention or the activity being delivered as planned? So in the first of the lecture, we said there is a totally 100% difference between monitoring and evaluation. Why that? Because evaluation will be happen after, let's say, the implementation of the project. And it will be requested by a donor or by your HQ or by whomever you are dealing with. Okay, so they will request that to ensure that the purpose of the program is being implemented right. We reach to the goal. So this is important idea to think about it. We reach to our goals, but how I make sure that we reach our goal? I should go and make an assessment. For example, I will do a researches inside the society to hear from them. I will do a call. I will do a survey to check if the deliverables happened. So the question is the content of the intervention or the activity being delivered as planned? Okay. Does the content of the intervention or the activity reflect the request standards? Okay. So here we can, there is something called the learning, and we will talk about it in our final lecture and the lecture before it. So in the learning, what you will get information about. Sometimes you distribute something to the people. For example, a jerry can, and you intend to let them use it for gas, for example. But you came after a while and you find out that they are using it for water. Okay. That's one thing, which is, we will talk about it in the learning. So we should learn from our past mistakes. So there's a standards for the humanitarian work. And there's something called the spheres. And the spheres is giving, let's say, the lowest human need standards. Let's say, for example, each person should have 1 liter or 2 liters of water, for example. If we back to the spheres, each one should have a shelter of 1 or 2 meters. You will back to the spheres and you will see it. So here is we intend to give a standards activities, which is why we are doing, if you are applying and training, for example, or anything, there's a pre-evaluation and evaluation after that to check what happened. And it has happened with the standards that we given. Have the intervention achieved the expected result, which what we said, the result that we are looking for. Okay, I came to you, I'm asking you for a donation, and you came to me and tell me, okay, I will give you a donation, but what for? I'll tell you I will improve the life of Lebanese people. Okay, you took the money, you bring me a report and etc. But how I can check if you really improved the Lebanese people life, which is something very hard. You should talk about 1 or 2 or 3,000, 4,000, 10,000 people, depend on the amount you have of money. Okay, so when it came here, how I make sure that you really improved the people life, maybe I will send a consultant, evaluation consultant, to check what happened to the people life before you were there and after you intervene in their life. Okay, so this is the evaluation. Okay, the development of the thing that you are applied for the beneficiaries, what happened after your project. So we'll talk about something cool. Okay, let's say it cool, but it is, yeah. So we will talk about indicators, this is something important, but sometimes they make it harder and sometimes it is very easy, because when you understand it, it is very easy to understand. So indicators, it is a measurement tool to indicate the thing that you are targeting. For example, if I wanted to go and have a health project, and this health project should target the pregnant women. So my measurement will be the pregnant women inside this area, for example. This is my measurement. That the indicator should be started with which sign? I will give you one sign in the chat. Sorry. Yeah, I will give it to everyone. Okay. So this is the sign. One sign. What do you think the other sign that used by indicators? And what that mean? This hash mean is the number of the people you are targeting. There is another sign, if you can put it in the chat. If you don't know, say I don't know. Guys, are you sleeping? No one here. Talking with myself. I don't know. Okay. Yeah.
Okay, doctor.
Yeah. Go ahead.
Can you please clarify the question more?
Okay.
Please. Yeah.
Okay. Okay.
Yeah.
Okay. So indicators is a measurement tool. Okay, let's make it a simple thing, but we will back with the definition and everything. If you have $100,000 and you have a health project, or let's say education project, and in your mind, the main beneficiary is the child, okay, in the area. So in the indicators, you will choose the number of the child inside this area, or the number of the child who doesn't have access to proper education, for example, the number. But it not always come with the numbers, because not always we have the right statistics one. And some other measurement, you cannot measure it by numbers. You can measure it by
Percentage.
kid, or what we call them, women's. That example. So what is this idea about? Because I want to clear it for you, not make it complicated. If you bring the 100,000 without saying there is indicators, you don't have a target. Who you will target? You should put a criteria. On this criteria, okay, I'm targeting the oldies, or the old men, or the old women's, or, for example, I'm targeting the adult. I'm targeting the toddlers. So when you are saying a specific group, with the specific number that you already have the number of it, the percentage of it, for example, now you know, let's say, how many people you will target, how many beneficiaries you will target. So you will say, my target is 5,000. And this is why it is important to do the assessment. And what is the assessment? We said there is mainly two type of assessment, but there's a lot of different type. There is a normal need assessment and there is multi-sectoral need assessment. What is the mean of need assessment? My field staff or any staff, or I hire third parties, or there is an organization, they are doing it and I got the information from them, or there is another resources. So I will get the information about the need of the people, but be careful. When you are putting the indicators, you are putting, let's say, a rope around your neck, because when you are saying the number of the people who have access to the technology, for example, and you find out there is no people who have access to technology, that will, what will affect your budget. And there is three kind of budget spending: over budget, overspend, and spend, and underspend. Underspend, if it is more than 15%, that means you don't have a good planning. If it is spend it normally, is that okay? But if it is above the spending limit of your budget, you are also don't have a good planning, and your organization will put from their bucket to this budget. Okay, so an underspend, be careful from underspend. So when you are putting a target of people, a target of beneficiaries, of animals, of whatever the thing that you are targeting, you should have clear data about that. So this is why we are using our most close one, which is our staff, our field staff, because we trust them, they will bring out the right result or the right research or whatever, the numbers. But when we are coming to the numbers, after you put the indicators, you will have something called baseline and target. Okay, so baseline is, I can have this one, okay. Let's present it like that. The baseline is your starting point. So what that mean? If we have 5,000 pregnant women in the area, okay, and this is your first project and there is no one helping this women, sorry, you will start from zero, because no one, you will start for all the beneficiaries. But if there's other organization, or this is your second project or third project on the same beneficiaries, you will start from the number that you left and your project ends. For example, your project end or your funding limit was helping only two, okay, and your target will be, okay, beneficiaries. So normal in our work, which is, this is, sorry, the household, the normal household, as a percentage, or as an average, sorry, it is 6%. And some in European standards, it is 5%, which is, you will see that in, and what that means, the household, which is the family, is on average, they have 5 people, okay? So when you are targeting a beneficiary, sometimes, and let's say sometimes, let's say 90%, when you are saying 5,000, you are talking about, for example, 5,000 families. If you are talking about an emergency line project, but in elder recovery, you will target people or individuals, and on development, you will mainly targeting individuals, and sometimes you're targeting families, depend on the services you are providing. Okay, so your baseline is your starting point from where you left or from where you start, and your target is the overall indicator that you put. So the indicator is a measurement tool to see, okay, the society have a million cases, but which case I will target, and how many people are there, what is the number of them, or the average, for example, not people, maybe animals or whatever, what we are working with. So the idea here, this is your indicators. You will say, I will target this person's. So if I targeting them, I will put them as a criteria. They are a women, ladies, men, boys, whatever. Food, wash facilities, whatever you are targeting. Okay, so let's back to our
Doctor?
yeah, go ahead.
Yeah. Can I say something?
Go ahead.
Yeah. There are a few European countries that implement the law. Like there are people with low income or no income at all that would provide free healthcare for their families. Yeah, like the government would provide free healthcare for them, like
Okay.
end users. Like if we talk about the people in need, I would say like the best people in this occasion would be people with low income or no income at all who cannot afford the healthcare.
Okay, that
For
will lead that
example,
to
yeah.
something.
Mm,
There is a family that they call them the most vulnerable IDPs, for example, most vulnerable, most vulnerable refugees. So what that
yeah.
mean? Those people, let's say, for example, if the household is a disabled person, one, if the household
Mhm.
divorced, if the household is widow, if the household one, oh sorry, in the family there is a disabled or handicapped people. So each cases will, the more cases they have inside the family, the more let's say likely they be on the top list of the helping or the giving
Yeah,
of the aid. Yeah.
fair enough.
So indicators, markers. Remember the word markers? Markers that help measure change by showing progress toward meeting objectives. But remember this word. Remember it exactly. Observable, measurables, agreed upon as valid markers or less well-defined concept or objective. So my question to you, from where you will bring your indicators? Let's go by Amna. What do you think, from where you will bring these indicators?
Actually, I don't know. I think from the output.
No, there's a place we bring the indicators from.
Yes.
Salar, go ahead, please. Thank you, Amna. Yeah.
Hello all.
Go.
I think the indicators we bring it from government document or outer resource from by collecting data from community, something like that. If I'm right.
Okay. Thank you. Hint?
We will collect it, I think, from the assessment that we will have, and of course, according to the available budget that we will get.
Okay.
Thank you.
Nadine?
Hi, I just wrote, I think we can get them from the relevant cluster.
Okay. Yeah, thank you. Saja?
I think from the field survey or planning of Ministry of Planning, this indicators, we can take it.
That's cool one. Okay, thank you. Who's we have? Okay, Salar already, Saja already, Omar already. Omar, what do you think from where to bring indicators?
Yeah, usually in European countries, they do surveys. The
Okay.
government does it usually, yeah. So I would see that it's the best option, surveys.
We said agreed upon as valid markers. So what that mean? There is a list in each donor. You can search it or find it for the indicator that they are using. 1, 2, in the clusters, let's say the health cluster, they will share with you before any, let's say the HBC or something will happen, the HRB after what will be applied, they will share with you the indicators. Also, there are some indicators you should keep in your mind that you should always put, like the gender equality indicators. Yeah, sorry. The gender equality, the BSEA. What the mean of BSEA, guys? If you heard about this one, the BSEA, let's give it something short, prevent sexual exploitation and abuse. And that what that mean? That I should, let's say, prevent my staff when they are giving services, not trade it with another things like sex or abusing or harassment or whatever they will do inside the work also, but mainly with the beneficiaries. And this is will lead us to the accountability. Okay, so remember this type of things. How we have a valid indicators, it is observable, it is measurable, and is agreed upon as a marker, valid marker. Yeah. So indicators differ from objective in that they address specific criteria that will be used to judge the success of the project. Also, as I mentioned before, it is should be sometimes there's a fixed indicators you have. As we said, there is common indicators like the gender equality indicators, the things that look like this one. It will help your proposal. One time I was sitting with the head of WFV, which was heading the cluster. So he said, I wish I find a proposal here in Iraq talking about gender equality and their indicators. Okay. Okay, so it is some criteria that I think BSEA, yeah, I'm really sorry. So I'm talking about the gender equality, not the BSEA, but I want to mention the BSEA because you cannot put it as all indicators because it is not a criteria to choose the people depend on a BSEA, but it's something you will put it on your implementation and how you will implement and in accountability. Yeah, so yeah. So type of indicators that keep that in our thinking. Okay. So the indicators and the input and the in the process, you can call it in the monitoring. and outcome and impact in the evaluation, we will use it here. But here we have a different type of indicators. So for example, the people who suffer from MS or program is helping the people from MS, or helping the people in Mosul for food or anything, or targeting some people inside the program or the project, which is the program we are talking about GovernNet, we are talking about an area or community, but we are talking about country, the people who affected from ISIS, for example. In global, for example, the number of the people who are affected from COVID. Okay, so this is a global indicator. If you want to send, for example, Putin will send his vaccine, he will send it for the people who affected from the virus, for example, or the people not affected for the virus. So this is the idea here. This is the global and country and the program level indicators. This is the case study. I think I will send it to you, the case study, to use it. So this is the 5 things you should keep in your mind about the good indicator. It is valid. Measure the effect it is supposed to measure. Okay. Reliable, give the same result if measured in the same way. Precise. So I can say, okay, everything is important, but when it comes to here, this is very important because the indicators will affect the budget. And when it is affect the budget, it will affect the programming. So you should keep in your mind when you are putting an indicator about area, it should be exist, for example, and should be the exact people that you will target or the exact thing that you will intervene in. Timely. So sometimes, you know, the context is changing, depend on the time, depend on the activities, depend on the other partners, what they are doing. So maybe they will get help that the people that you are targeting, or the facility will be get built. So you should be timely and timely bound also. And the time that you will, let's say, start implement your project. Comparable can be compared across different target group or a project. Okay, yeah, there is some rare groups you can choose your indicator on, because okay, let's make it easier without the terms and the crumbs of humanitarian. When you was in a school or when you was in college, they ask you to do a survey. Okay, when they ask you to do a survey, there's a targeted people that you will go to do with your survey for. Let's say the student in the next class, the student in the next stage, the female student, the male student, the student that they are not wearing, let's say, a suit, for example. So you was using the indicators from the start, when you was in college. So this is the idea. This is the things, the markers you will put to choose your exact targeted group. Okay, so you can compare it with other segment or other people or other indicators. Okay, so it should be comparable. Okay, guys, if you have any question here, ask me. Okay, because the indicators is the main part of the monitoring and evaluation. Okay, so criteria for indicator selection. Consent with the project design. So what is the project design? Okay. Project have 3 main items: time, cost, scope. Okay. Time is the period of the implementation, which is, we said, mainly you have 3 options, and there's a between, which is emergency, recovery, and development. Maybe 6 months, 1 year, 10 years, 8 years, 4 years. Okay. So this time you will create a project. how you will design it, you should choose the right people or the right exact beneficiaries to target them. So the first thing you choose in your planning is the target. That's obvious. But from where you bring the target? From the research, from the surveys. Also, the same donor that we talk about, or the clusters, they already have their own surveys to reach the country development level or sustainable development goal for the country. So they are putting these indicators, and you should put it in your proposal. Okay. And you'll put a scope for your project, which is how many things that you will give, how you will give it, by what you will give it, how many resources you will have, and you will need, what the thing you will need to develop, and on the end, how you will focus on it, how you will monitoring it, and how you close it. That's the project design. Okay. So the main thing that you will do mainly is to define your indicators. Useful contribute to project design management and evaluation. That nearly the same. Available. Okay, we said if you are outside the place and you will put indicators without seeing the place, without talking with your field staff, here comes the gap. And when you come to apply it, you will find out, oh, okay, I don't have this kind of things. So what I have to do? Can I ask for changing in my proposal, for example? I don't think they will accept, the donor will accept. So this thing you will have it in the intervention if you don't talk with your field staff. So this is why we trust our field staff. Okay, because they are working with us and they are representing us in the field. So you always should give them a trust, but not always, because we will fall in a lot of gaps. Because when you have power over people, not I'm talking about you, I'm talking about the field staff, there are some problems will happen, especially if you are from the same neighborhood. Okay, affordable, that means it is near to the budget that you proposed. Don't ask, as I told you, when we open the OBS, you'll find out a lot of titles that wrong, like for building better Iraqi future. Okay. How you build better Iraqi future? There's billions of dollars and nothing happened. So you should put in something affordable. You cannot say I will help everyone in the globe to let's say get rid of COVID, for example. Yeah, so it should be affordable. Where possible, a project should select standard indicators. They have been tested for validity and reliability. They allow a comparison between a project or site. They tend to be available for strategic objective and some intermediate results. Okay, guys. Okay. How many indicators we have? Okay. The more indicators you will put, the more criteria you will put, the more clever you are when you are putting the exact numbers. So if we back to what we said from where we bring the indicators, let's keep that in mind. So sometimes I cannot go to some places. So what I will count on the media, for example. And this is why you should avoid the media when you are getting your report or researches. So if we back to Mosul, when I was a program manager, some of the magazines saying that 100,000 people will flee from Mosul. Some other magazine will saying, I'm not only magazine, newspaper or something like that, or news site, 90,000 people. 20,000 people, 100,000 people. So each one is different. If I count on one of these and do my programming to do a program or a project for this one, I will fall to not achieve my goal. And this will be a dark point for my organization because we don't have a good planning. Okay, each one of you, if you are working on a program, you know what I'm talking about. So the idea here is you should bring the real information. Ask for the real information from your staff, from your cluster, from the people who are done it. Ask for this information and check it. Check it again. See if it is reasonable, these numbers, okay? Because as I said, when you choose the number of the people, you will choose the number of 8. And when you choose the number of 8, you will increase the budget depend on the number of 8. And after that, if you not achieve it, you will fall in some problems. Hopefully you will not fall in any problems because you are smart enough, okay? So how many indicators? This 2 were intermediate result, and this here is not fixed. It is depend on your programming. Maybe for each objective you have indicator, or for each activity you have small indicators and big indicators. This big indicator will be for the overall project. Okay, guys. So we will not back to this one. We'll back to here. I want you to take a screenshot for the case study. Okay. Take a screenshot or take a photo for it. And I'm waiting from you the one that we said we talk about, that we should write it down in the Excel. This is the 3 cases. Amna will be case number 1. Hind will be case number 2. Nadim will be case number 3. Omar will be case number 1 with Amna. Salar will be, Saja will be case number 2 with Hind. And Salar will be with Nadine for number 3. We have remaining, I think this is everybody in the list, but they are 8. Okay. So it is by sequence right now. Okay, guys. You will see this and you will give me a valid indicators for each one. This is very simple. Okay. And remember the thing that I told you to do it, the table. You will put the information, you will divide the information in this table. What is your activity and what is your output and outcome? And we will solve it. Even if you fail, we will solve it and we will talk about it. I think we're done from today. If we have any question about the indicators, please go ahead. If you're not, we will close it and talk the day after tomorrow. Okay. Okay. So thank you for your time, guys. Hope you have a great day and take care, everybody.